So, this is an important question. I think the use of eye movement desensitization and reprocessing, EMDR, for the treatment of chronic pain is still a matter of debate and research. While some studies suggest that EMDR may be effective in reducing chronic pain, the evidence base is not yet strong enough to support its routine use. Accordingly, current guidelines for the treatment of chronic pain do not recommend EMDR as a first-line treatment for chronic pain. However, the guidelines suggest that psychological interventions should be considered as an adjunctive therapy for chronic pain in patients with psychological comorbidity or a high level of emotional distress. So based on the evidence available, it can be summarized that EMDR can be considered in particular for those patients that are characterized by psychological comorbidity or a high level of emotional distress. So there's a growing body of research investigating the effectiveness of EMDR for the treatment of chronic pain conditions. And overall, there have been more than 8 randomized controlled trials to explore the effects of EMDR on chronic pain on various different pain conditions. For example, on musculoskeletal pain, fibromyalgia, rheumatoid arthritis, phantom limb pain or migraine. And all of these studies report positive results in a range of moderate to strong effect sizes. And none of these studies report any severe negative side effects. So we can assume that EMDR seems to be a relatively safe treatment approach. However, most of these studies were characterized by a monocentric character, by a small sample size. So this limits the general ability of the studies. Despite these limitations, there is a growing body of evidence that EMDR might be effective for the treatment of chronic pain. And interestingly, there are some proof of concept studies now coming out that show that EMDR for the treatment of chronic pain can be applied remotely, so via online tools or the internet. So this increases the access of this treatment approach in particular for those patients who are not able to access in-person sessions. So overall, more research is needed to fully understand the effectiveness of EMDR in the treatment of chronic pain. However, the available evidence suggests that EMDR is a promising approach for the treatment of chronic pain. Yes, there are some particularities in research related to EMDR for the treatment of chronic pain. So in 2019, an animal study was published in the journal Nature that identified a specific neural circuit that is modulated by EMDR. This is significant because of 2 reasons. First, EMDR is, this is showing the study, one of the few psychotherapeutic approaches that can be studied in animal models, which opens, of course, new avenues for research. And second, this study found that EMDR modulates a neural circuit that is also involved in pain processing and pain chronicity, which helps to explain why EMDR has shown such promising results for the treatment of chronic pain. So this finding provides a potential mechanistic explanation for the observed effect of EMDR on chronic pain and may inform future research into the underlying mechanisms of action of EMDR. I think one of the most promising approaches is the EMDR Pain Network initiative. Within this initiative, standardized diagnostic and treatment tools are made available in order to explore treatment trajectories across centers. So any EMDR therapist who is interested in and who treats patients with pain can participate in this initiative. And this will enable researchers to build up a large database to identify what patients are likely to benefit from EMDR and what patients are not. And at the same time, this network provides an important base for conducting future multi-center high-quality trials to prove the effectiveness of EMDR and to pave the way that EMDR can be included in current guidelines.